This is the one-page prep. It has three main focuses. One is that we have written the aims for our residency, and I'll show you that in a moment. And this was done by committee, and it was done on April 20th. The second thing is all the ACGME requirements are done through a process, sometimes by committee, and that we have a policy for every facet of the ACGME requirements. And I'll walk through two of these in particular. And number three is that we have a track record of improvement. Every year we create a set of priorities to address issues that are identified by the attendings and also issues that are identified by the residents through anonymous surveys by BUMSI, and we pick the major ones and address those, and some require more than 1 year, so we track those improvements, and I will show you the past 5 years track record of improvements. Going back to process, there's two particular things I want to highlight, and one is that there's two steps that were involved before Tuesday's meeting, and one is that we updated our self-study. So our first self-study was done in 2015. We went through a process of creating aims, which are the same thing as goals, and now we are allowed to update those, so we've updated our self-study material. The second thing that was done is we've created a summary of achievements, which are things that we've accomplished since 2015. So we've created two documents. One is an update to the self-study, which includes updating our aims, and number two, we've created a summary of achievements. And the second thing I want to highlight with process is there's two particular committees that I want you to know about. One is the CCC, or Clinical Competency Committee. This meets twice a year, and we assess every resident for their milestones, and we tell the residents about the feedback by the program director to the resident one-on-one, and we call those the semi-annual meetings with each resident. And the second committee I want you to know about is the PEC, or the Program Evaluation Committee. That meets once a year, and that's where we as committee go over areas of improvement and track prior progress, and if we've resolved any issues in the past year. And so that process is called the APE, or the Annual Program Evaluation, which is conducted by the PEC, the Program Evaluation Committee, and every year we track our progress, and I'll show you that. So this is the updated aims, and the main thing to know is the blue highlighted elements. So if you were to describe our campus and our residency, it would be that we are set in an academic campus, that we focus on hands-on real-world experiences, and that we expose our residents to elements beyond radiology. And if we look at those elements beyond radiology, we talk about business, we talk about professionalism, wellness, healthcare, economics, and now we're adding an element of global medicine and charity. This is a lot of the requirements. Every resident completes a scholarly activity, which can be a presentation, a case in point publication, or a research project that is published. And every resident completes a quality or patient safety project, one during their residency and one scholarly activity during their residency. And during their residency, at some time, they participate in a hospital committee or a quality committee. So these are all things that every single resident does before graduating. And then if we think about our specialty, we do hands-on training. We are in the reading rooms and in procedure rooms side by side working with the residents. We are going to aim to really focus on clinical interactions with both patients and referring physicians, and maintain a healthy wellness emphasis in our work. And then we use all the advantages of our practice, which is inpatient, outpatient, emergency care, disadvantaged patients, and specialty care. If you think about our strengths, number one, our strength is our people, both our attendings and our residents and our support staff. our culture, which is very supportive amongst attendings and residents. You know, when people take care of each other, help each other out, fill in when we're not able to work. And then we use all the elements of our practice in our academic setting. This is a list of 5-year tracking of our improvement, and they're linked to our aims. A lot of things to do with training, some things to do with advancement. As we go forward, we'll add more things to our Beyond Radiology aims. And these are all things that we've accomplished in the past 5 years. You can see 2014, 2015, 2016, 2017, things that we've accomplished, that we set out to. And you can see that we have issues that we continue to work on that are current problems, and we'll create a new set of issues for this summer, for the next year, and carry over the issues that we have not resolved. This is kind of the new process for the ACGME to track improvements and continue to create improvement in issues that we identify and that we aim, that are part of our aims. This is the bit longer prep sheet, and I'll show you that there are 9 subspecialties which you know about. Abdominal, we usually think about it in 10, but abdominal includes both GI and GU, so the 9 subspecialties. There are things that the program director must address. Here are the issues that the attendings must address, and we always focus in on this complete evaluations within 14 days. This is an ACGME requirement. There's scholarly activity requirements collectively for us, and that the faculty are devoted to spending time, that they do fatigue management, they do faculty development, and they supervise procedures. And that we sign off reports, and that we maintain our subspecialty and work in our subspecialty. We've talked about the Clinical Competency Committee. All residents, our residency is compliant with the didactic requirement, which is just 5 hours per week, and we easily do more than that, and this is an average. That residents do have protected time, that we do maintain attendance sheets and track that. That the core competencies is something that you know about because you do it in your evaluations. The curriculum requirements, we have a 2-year repeating core didactic that we track, and we maintain that we repeat it and do these topics. There are didactic requirements. We do cover socioeconomics. We do professionalism and ethics. There are a number of things that are specific to nuclear medicine, and we do all of them, and we maintain that by every resident has a notebook and does all of these requirements, and before they graduate, we have that all of these activities have been checked off and signed. So we have all of these requirements done. And then there are some minimum procedures and imaging requirements, and these are all checked before they graduate. With BCLS, all our residents do ACLS training also. And with scholarly activity, we talked about before, every single resident does that before graduating, completing 1 scholarly activity before residency. Same with quality projects. Every single resident does one before completing residency. And with hospital committees, every single resident serves on 1 committee during residency. Duty hours, it's an easy one for us. We never have duty hour violations. The one thing you should notice is that all moonlighting activity is counted toward duty hours, and our residents do count them and are told to count them toward their duty hours, and we do require approval by the program director. Educational resources in radiology, you need to have the ACR teaching file or equivalents, and we provide a number of those equivalents. We do have faculty evaluations. both by the program director of the faculties and also by the trainees. And this is done confidentially, and that confidentiality is through New Innovations, and that is um, monitored by the chair of our department, that they are done confidentially. We're almost done. All the evaluees are evaluated. There are semi-annual reviews, um, and we meet with them one-to-one. And there's also 360-degree evaluations by the techs and nursing staff of our residents. So we have a very thorough evaluation process, and that all our evaluations we do maintain within 14 days a high percentage of evaluations, and certainly meeting the bar set by BUMSI for us. Faculty development, this is I think a hard one for us, but we do maintain that our faculty do what's required for faculty development, and that includes fatigue management. And one thing to know for this fatigue management, beyond every resident and faculty yearly get faculty training on fatigue management. Um, there is a plan for if a resident cannot work, and if the resident cannot work due to fatigue, illness, or family emergency, the first step is to they contact the chief resident, and they will create a plan for uh, backup if it's required. And then there's a chain of command to include the program director, the assistant program directors, and they can even invoke our chair of department and vice chair of department if other people are not available to allow a resident to stop working if they are fatigued, ill, or have a family emergency. And we have a number of ways of providing coverage for that resident if it is required. Um, Goals and objectives. Every resident does check their goals and objectives before starting each rotation, and we document that through New Innovations. We've talked about milestones, something you know about. Learners, anytime another um, kind of learner is introduced into a rotation, such as medical students and nurse practitioners, we pay a lot of attention that they do not interfere with the learning of our residents. And it's something done both at our residency level and at the graduate medical education level. We talked about the PEC already. All procedures are supervised. There's multiple levels of supervision, but even when a resident does a lumbar puncture by themselves on the weekend, that is an appropriate level of supervision because we've documented that they've done an adequate number supervised, and then now they move to a higher level of supervision, which is indirect supervision, where they can call for help if needed. So every single procedure in our residency is done supervised at the appropriate level, and we have a grid that maintains that level that the appropriate level of supervision is given. Transition of cares is a hard one to make it relevant for us in radiology, but the main one is in the evening we have a whiteboard where any issues that need to be handed off are called down to the ER resident, radiology ER resident, and they write it on the whiteboard and maintain that a good transition is done. And we monitor that when occasionally our attendings do work down there in the reading room, and they monitor that process. So it's both we have a process and it is monitored periodically by attendings. We've talked about quality safety, and the residents all know when they need to call and notify attending about an adverse event. And another kind of issue is that they are involved with quality simulations. We teach about root cause analysis and do simulation. We talk about various versions of reporting, and the main one is our residents are taught to report misses and near misses using the BUMSI hotline. So this is a key issue here. And lastly, we have a fairly robust plan now for wellness. We have wellness weeks. We have morning coffee sessions about wellness. and social activities geared toward wellness. And here's that bit about we have a plan for if a resident's unable to work, especially due to fatigue, and the residents all know about this plan. And here's a bit else. If there are things that you feel are greater about the program, bring them up. So that's it. Thanks, and good luck tomorrow. Appreciate your help.